Cindy Hodgson from Essential Therapies here. So we've done a few videos already about fascia and what it is and how it becomes restricted. And today we're going to talk about myofascial release. And I will mention that myofascial release is a term that is often used for many different types of body work. So even though someone says myofascial release, it doesn't mean that they're all doing the same thing. So one myofascial release therapist may have different skills or techniques than another one. So the method that I'm going to talk about, and I believe is truly the most authentic type of healing, is John F. Barnes' myofascial release approach. So what makes that different is that we have a different approach in how we approach each patient. We look at that patient as an individual. We don't see it as a protocol that we need to go through certain steps to reach a certain outcome. Every body is different, and every body has had different injuries and different postures and different things happen to them, not only physically but emotionally as well. So we look at each person in standing and we see what gravity is doing to that structure. We talked about the fascia and how it connects everything together throughout the body, and how the skeletal system is really dependent upon the tightness of the fascial system. So when we look at someone in standing, we can get an idea of what doesn't look symmetrical, and we can feel that tissue and see what gravity is doing to that tissue in standing and get an idea already of where restrictions are. And then we look at the body laying down and we feel or pull into the body and feel those restrictions and start working on it as well. So with John Barnes' myofascial release, we are looking at the body as a being that is bioelectric. And the difference, the primary difference, people always ask, well, what is the difference between the myofascial release that you're doing and this other myofascial release I had? They didn't do what you were doing. It was definitely different. And I would say primarily the biggest difference is how long we hold the releases. So research is just now starting to come out with exactly details about what John was teaching over 40 years ago, and he could feel within his own body. And what we're finding now with science is that the longer we hold these releases, and when I say releases, what we do is we take up the slack of this tissue, this restricted tissue. We either press or pull into the barrier in the body, and we take up that slack and we wait. And we wait and we wait and we wait for at least 3 to 5 minutes. And what happens in that 3 to 5 minutes is this bioelectric change in the body, which then goes into another change, which after 5 minutes, the body actually starts to create what's called interleukin 8, which is a chemical within our body that helps to decrease inflammation and actually fight cancer. Also interleukin 3, which helps to increase our white blood cell activity, which helps to fight disease and other problems. And then as we continue to hold that release, waiting for this change to occur, we have another electrical change which has to relate somewhat to the vibrational frequency of the therapist and the patient, and how that comes together and allows for an opportunity of that tight restriction in the patient and that stuck energy that's there to be let go and release. And as we wait and wait for this change to happen, and we're feeling, so it's not just watching the clock and waiting for things to happen. With the skilled hands of a therapist, we are literally waiting for that tissue to let go. And sometimes it takes way longer than 5 minutes. And sometimes it's, around that time. But depending on how stuck that tissue is, we really need to be patient. And that's really the difference between the Barnes myofascial release approach and what he would refer to as the old myofascial release. The other thing that I think is super important to understand as far as difference is that we are very gentle in our approach. We never force the tissue. We never get in there and really dig to a level of pain. Now, sometimes we're getting in there a little deeper because the restriction is deeper. And when that happens, I'm always working with the patient and being open and communicating continually so that they know that they can always tell me to ease up. If they can't soften and breathe and relax into that, then it's too much. So we should never, first rule of medicine is to do no harm. And I think what's really important to understand is that this method really uses the patient and therapist interaction as a way to reach into the body in a safe and very effective way. It's lasting that way. These other therapies and other modalities that either move too deep beyond the barrier or don't go far enough into the barrier, and they don't wait long enough for all of these things to happen, which now they're finding out in research is actually going on, then they're not lasting. So you may feel a little better for a couple of days, but if it's not lasting, it's probably because that deep myofascial restriction has not been released, and it probably hasn't had enough time to do so. So, one of the things that I look at as a red flag with people I talk to who are considering myofascial release, if you've had testing, medical testing like X-ray, MRI, CT, they don't find anything. Maybe you've already had physical therapy, you've had some chiropractic work done, maybe massage therapy, and maybe you've had some benefit and some relief, but you're still having some problems there. It might be because those deep myofascial restrictions just haven't had the time to release during a therapeutic session that is needed to get beyond that level of dysfunction. And I can tell you, I've seen so many people over the years that have been able to let go of things that they never thought could happen. And it's just really amazing. And I'm just so thankful to John Barnes and the fact that I somehow just miraculously ran into this, and I feel grateful every day that this is part of my life. And I think at some point in the next few days, if you're interested, I may tell a little bit about my story. It's something I do tell patients about here and there, and it's not, a fantastic story. People certainly have better stories than mine, but I'm just so grateful that this is part of my life. And next we're going to be teaching you some self-treatment techniques. And if you have any questions about anything, please comment below. Look at the other videos if you haven't had a chance. And thanks so much for joining us. Have a great day.